You've had an opportunity to see the BruxZir Full-Arch Implant Prosthesis before. Again, this is the solid zirconia product that stands a chance of displacing the hybrid denture sitting on top of a bar because it's not made of acrylic and denture teeth. This is all solid zirconia. You've seen us hammer a single unit BruxZir crown into a piece of wood before. That's at 1.5 millimeters thick, and obviously this is a lot thicker than that. So we're trying to decide what to do. The hammer test is too easy for this. We need like a steamroller or drop it out of that big Red Bull rocket when that guy did that dive from space, let it hit terminal velocity before it hits the ground. But I wanted to just kind of walk through the steps with you because I got some emails from dentists asking about the clinical steps. So the first thing that we typically get from the doctor is an implant level impression. It doesn't matter if it's closed tray or open tray, but we get that implant level impression. And the second appointment when you see the patient after you've taken this is going to be with the bite block. And the bite block is going to come with a couple non-engaging inserts. And oops, little screw fell out right there. And it's not going to actually have all these holes. It's just going to have 2 holes. It's going to get screwed into 2 of the implants, and so typically it'll be 2 screws back in this area. I could probably screw this into place, although we don't really need it to be into place. But again, it's just picking 2 of these that are roughly parallel. It's going to get screwed down into place, and as you can see, it's got some cutouts here to do the bite registration. So you're going to squirt some bite registration material between this wax rim try-in and or bite block and the opposing. This would be a good time to start working on the vertical too, kind of like in a denture technique. You can remove anything that you need here. You can add wax where necessary. You're going to probably pick a shade for the tooth as well at this appointment, because at the next appointment you're actually going to try in the setup, and the setup is going to look a little bit like the final restoration looks, except it's going to be in wax. And now you will actually see that everything has, all the holes have been placed in this. In fact, at this point, we're going to decide whether or not multi-unit abutments are necessary. In fact, if you look at our inclusive catalog, you'll see several different versions of the multi-unit abutments that are available. There's the straight multi-unit abutment, the 17-degree multi-unit abutment, and the 30-degree multi-unit abutment. And so implants are rarely placed perfectly unless they're done with a surgical guide, of course. When they're placed by hand, oftentimes some will be inclined to the mesial, some to the distal, some to the buccal. And so the multi-unit abutments allow you, with the 17-degree angle and the 30-degree angle, to take care of some of those off-angle implants to get a result like this where it draws a little better, and we're going to be able to have our bridge sit down on top of it. You'll also notice that there's a couple different collar heights on these as well. For example, the straights come in the 4.5, a 2 millimeter, a 3 millimeter, and a 5 millimeter cuff height right along here. You know, on this arch that we see here, everything's perfect as we look from anterior to posterior. But typically there could be an area where the bone drops down because the extraction that was done there was done a couple decades ago. And so when implants are placed, you know, we may have an implant that's at this level and then another one sunk down a couple more millimeters. That allows us to take a multi-unit abutment with, say, a 5 millimeter cuff height and be able to place that there. So again, they're almost on an even plane here. So you'll notice that the multi-unit abutments not only give us some flexibility with implants that aren't all placed in the same plane with the 17-degree angle and the 30-degree corrective angle, but also in terms of vertical height as well. If once the implants are placed, they're at different vertical angles. The multi-unit abutments allow us to line them up a little bit better, and hopefully this is the type of result we're going to get where we look at a model like this and everything draws pretty well and is in the same vertical plane, because that's going to give us the best results for having a great final prosthesis. At this point, when all the holes, all the implants are being accounted for, we're going to find out and see exactly where any of the access holes for the screws are going to be, because sometimes we'll have something just because of the angulation of the implant where there's a screw hole coming out of the facial, perhaps of an anterior tooth. Sometimes you'll see it popping out of the side of a bicuspid. You might be able to get away with that and place a little composite over it. And so we have some multi unit abutments that we see here. That'll be determined when the setup try-in is actually being designed and being fabricated here in the lab. And so at that point, if in fact there is a need for multi-unit abutments, you would put those into the mouth at this time. And so one of the things we're going to do besides this wax try-in to check that for aesthetics and phonetics and all that good stuff, this is going to be the time for the verification jig. And so it's going to come to you numbered like this on a model, depending on how many implants are there. You'll see how many segments that you have. And of course, these are going to be placed on top of each of those and then screwed down into place. The white material that we use to fabricate this jig is in fact triad. And so if you have triad in the office from, say, a custom tray technique, you can use that. Some dentists use Duralay. You could use flowable composite. You could use another acrylic or anything light curing. And you're going to screw all the segments of the verification jig into place. And when they're all seated together, then we're going to lute all of these different segments together, hook them together, and as opposed to the beginning where an open tray or a closed tray impression would have worked, this is definitely going to be an open tray that's used with a custom tray at this point. And so once all the parts of the jig have in fact been luted together, then we're going to express our impression material around the jig into the tray, seat the tray, clear the heads, let it set, and then unscrew all of these so we can take the jig out and it'll be contained in the custom tray, and that will get sent back to the lab. And then it's time to put the setup try-in into the patient's mouth and screw this down into place and get an opportunity to look at it and see how it looks in the patient's mouth. Is there anything that needs to be added? Are the teeth positioned properly? How are the phonetics when the patients talk? Does it look like it's going to be cleansable? These are all important things to take care of. Is the patient happy with the shade? Because essentially when we're done with this, there's one more chance down the road, but essentially at this point, if you're in love with how everything looks, this can be sent back to the lab and it's going to be copy milled. This is essentially the template for what's going to be the final BruxZir bridge. And so what you see here is what's going to be replicated in zirconia. So it's important that at this point you're able to really make sure you have things dialed in. What we suggest, what I suggest, and what we think is a better idea, and it's now really included as part of this service, is this milled PMMA bridge that you see here. And again, this was set up by hand. The setup try-in in wax is set up by hand. But then the file, once this is scanned, that's what's going to be used to mill this. And it can also be used to mill this PMMA bridge. And essentially what this polymethyl methacrylate bridge is a long-term version of this, of the wax, or a short-term or provisional version of the zirconia. So you can imagine placing this in the patient's mouth and having, say, 20 or 30 minutes to try to determine whether or not everything here is the way it should be. You might be able to get a handle on the occlusion and if the patient likes the shade and the setup of the teeth. But really, what's it going to be like when the patient goes home and chews and try to eat with this on? Is it going to be cleansable? Is food going to be caught, several places because it's kept high and dry? Is the patient not going to be able to clean it because there's too much of an undercut under the flange? It's too much of a ridge lap. And these are difficult things to figure out in a 20 or 30 minute appointment. But if you're able to take a PMMA bridge and put it into place and screw it into place for the patient, now they're able to go home and wear this, for a month or two, a couple weeks if that's enough for you, or for a month or two. If this is a male patient, they'll probably want to go home and show it to their significant other, if it's their wife or whoever, to make sure that they're happy, pleased with the way it looks aesthetically. They'll get a chance to talk much more. In the office they can say 55 and other things like that to check the phonetics, but really in their everyday speech, where they go home and they get angry at their dog and they speak quicker and louder, or if they're the boss at work and they talk down to their employees, that kind of tone's a little bit different. And this really gives them a chance to kind of test drive what we saw in the wax try-in, but they can eat with the PMMA bridge. They can drink coffee, they can sleep with it on, so they can have some parafunctional activity at night as opposed to just having this in for 20 or 30 minutes. And don't get me wrong, in the old days, dentists would use this and they would verify it in 20 to 30 minutes, and then the full arch prosthesis would be made from this. So you can do that, but it's much more prudent, and that's why it's now included in the overall price of a case like this, that this PMMA bridge is in there at not only as a long-term provisional, if you will, but kind of a test drive of what the BruxZir solid zirconia full arch bridge, how it's going to act in their mouth. And so you can go into it with a lot more confidence, knowing that, oh, okay, well, we've shortened these teeth just a little bit. And if you have shortened this teeth and maybe you've added a little something over here or taken something away, when you're all done, you can unscrew this and send it back to the lab, and then this will be what's scanned and used for the final restoration. If you have this PMMA bridge in place for, let's say, a month or two, and there are no issues, you don't have to change anything, that's fine too. The patient can just continue to wear this, and this has already been scanned, and so the final restoration will be made identical to the PMMA one that you and the patient are happy with. They can just simply continue to wear this until the permanent solid zirconia bridge is ready to go in their mouth. If you take this out and send it back to the lab, obviously whatever they were wearing before the implants were done, maybe a full denture, or maybe you have an implant retained biotemps bridge that sits on top of this, you would go back to that if you've made changes to the PMMA, because that's now going to be copy milled to come up with the final restoration. So that third appointment is the wax setup try-in, the verification jig, and the final impression, and then you would try in the PMMA bridge at that next appointment, wear it, make any changes, and then the final appointment is going to be the delivery of the final prosthesis once the PMMA has been sent in, and that is put into place. And you don't want to really have to make any adjustments here. If you're making any adjustments, you'd like to be able to do it on the wax with the denture teeth, with the candelor denture teeth, or even once the patient wears it and finds a lateral interference because they weren't chewing food here in the office when you were checking them. Now they're chewing food and they keep bumping a tooth over here. Making that adjustment in the PMMA is much easier than making it in the actual zirconia once it's done. So the utilization of the PMMA bridge as a long-term provisional is a great way for the patient to really be able to check all their excursions in some real-world circumstances, not sitting up or lying down in your dental chair, but going through all the particular motions and habits that they have on a regular day. So the ability to use the PMMA bridge, and of course it's not stained on the lingual like the final prosthesis will be, because no one's going to see that here. This really is a great step to make sure that the patient's happy with what they have, and for you to be able to make any changes before the final restoration is actually done, because this is a big, expensive, I mean, it's affordable at our lab compared to a lot of other labs, but it's still an awful lot of work, and you want to make sure that the patient's totally happy with it. So the day you deliver this and put it in their mouth really should not be much of a change from what they've been wearing for the last 2 months, except that it should look better. And so what a great change for the patient to be able to come in and either switch from this directly to this, or from a denture to this. But regardless, they've had a chance to live with this in their mouth and get used to this tooth arrangement. You've made any changes, and it should take just about all the questions, if not all the questions, out of delivering the final prosthesis. And on that very last appointment, when the BruxZir Full-Arch Implant Prosthesis goes into the patient's mouth, you should have a patient who's very satisfied, very happy with how it looks, and you should feel very satisfied at the fact that this insertion appointment was simple and straightforward because of the use of the wax try-in and the PMMA bridge. By the way, all those steps that I just went over have been put together in a step-by-step restorative protocol. So if you're doing your first one of these cases and you want to make sure you know exactly what you're doing, you can go to BruxZir.com, and in the lower left-hand corner of BruxZir.com, you'll see one of the buttons you can click on is to download this restorative protocol. Alternatively, you could also call the lab, talk to customer service, and ask for the BruxZir Full-Arch Implant Prosthesis protocol and have it mailed to you. But probably a lot faster to go to BruxZir.com and look in the lower left-hand corner. And that way, when you go to actually do one of these cases for the first time, you'll have a step-by-step with photograph description of what needs to be done on each of the appointments, from initial impression all the way to delivery.